It's a real pleasure to be here. Before I dive into the results and tell you what you've been waiting to hear about, I wanted to give you a bit of background on who Wellcome are and why we've conducted this survey. Wellcome is the world's second largest charitable foundation. We exist to help improve health for everyone by helping great ideas thrive. We fund scientists, we support researchers, we back priority areas like planetary health, like vaccines, improving diversity and inclusion in science. But we know that if it's health that we care about, if it's improving health that's the ultimate goal, if we only care about the science, we're really missing a trick. If we don't think about how that science is perceived, how that science is used, how that science is accessed by the people who we ultimately exist to benefit, then we're not fulfilling our responsibility or making the most of our opportunities. So that connection between science and the public and health, that's really crucial to us and indeed to our mission. The problem is that most of the research that's been done about that connection has largely taken place in what we call the rich West or the global North. There's tons of studies, places like here in the US or in the UK or in the European Union, some elsewhere as well, like Latin America, the barometer there. But we've, up until now, lacked a real global picture of how do people think and feel about science and health. And that's what we wanted to solve. We wanted to say, let's take that snapshot, let's build that data set so that everyone around the world who can benefit from health will hopefully have the chance to do so. I'll dive straight into the results. I don't know if you know, but we've had a small issue in the UK over the past few years. It's called Brexit. And one of the questions that's kind of really framed, I think, almost all of political debate in the UK in the past few years since then has been this question of trust. Who do people trust? Do they trust experts? Do they trust scientists? Where do they go for facts? And I guess it's posed a bit of a crisis of confidence for many institutions, and in particular institutions that rely on science and facts and evidence to achieve what we want to do in the world. So we wanted to ask, do people trust scientists? And if so, to what extent and where? So we asked people a range of questions. We asked people, do they trust scientists to do their work for the public benefit? Do they trust scientists to find accurate information? Do they trust corporate scientists or academic scientists more? A whole range of different questions about trust. And then we composed an index out of that and gave people a score of 1 to 4, depending on how they answered the question. And what we found overall around the world, I think, is relatively encouraging, that if you look at the people that have moderate to high levels of trust, it's 72%. So nearly 3/4 of people around the world are pretty positive about scientists and the work that scientists do. You may be thinking science is worldwide, but languages are very fragmented and people come from different cultures. How was that question perceived? And we had the same concern when we were asking the question. So one of the things we did with our partners, Gallup, was try to make sure that when we asked this question, people were interpreting roughly the same thing. So we gave people a definition of science. We said that science is the understanding of the world, including of the earth, nature, and medicine, that we have from observation and testing. And clearly, that's an incomplete definition. It doesn't include the idea of science as a process, or as an institution, or as a community of people. But in the multiple definitions of science we tested, this is the one that seemed to stick the most and be the most universally understandable. And we did this for almost everything in the survey. So this survey was done in over 140 countries worldwide, many different languages with over 140,000 people. And this process of testing how things were perceived before they were answered was crucial to how we got the results. Obviously, the thing that's most interesting is the regional breakdown. And what we see here is how that pans out across the world. You've got that global figure there at the very top, that 18% of people have high trust in science, 54% have a moderate level of trust in science, and then it breaks down. And you can see that there's an interesting regional breakdown. So if you look at, for instance, Northern America, 26% of people, over a quarter, so the Northern Americas, the US and Canada, have high trust in science. And it's even higher in Central Asia, 32%. In Northern Europe, it's 33%. In Australia and New Zealand, it's 33%. But there are other regions in the world where the figure is much lower. So if you look at the light blue bar, those are the people who have the least trust in science. In Southern Africa, that's 30%. Central Africa, 32%. South America, 30%. So although there is this global good news story, it really isn't a kind of a simple story of saying, right, we can pack up and go home. We need to look at where this is happening. Interestingly, if you want to know the absolute top countries for this, In Uzbekistan, 54% of people had high trust in science. That was the highest in the world. Belgium and Tajikistan, 42% second. We were particularly interested in what happens in countries that invest in science. So there's a UNESCO report, I think a few years ago, that found that 72%, so nearly 3/4 of all the scientists in the world live in a Big Five country, Big Five being China, the US, Japan, Russia, or the European Union. So we wanted to know, does trust in these countries, trust in scientists, is it different from trust in the rest of the world? And there's two ways of looking at this. If you look at the high trust figure, if you live in a Big Five country, 20% of people have high trust in scientists. And if you don't live in a Big Five country, it's 17%. So not an appreciable difference. Where we do see a difference is in low trust. So in a Big Five country, only 9%, less than 1 in 10 people, report low trust in scientists. But in the rest of the world, that rises to 17%. And of course, we see variation from within these Big Five as well. So we find that in the US and the European Union, 1/4 of people have high trust in scientists. But in Japan, it's 11%, so less than half than that. The UK, despite the kind of the concerns that I think scientists in our country have, is pretty good. It's one of the highest in the developed world, 35% of people reporting high trust in scientists. But we wanted to know not just where this variation was, but why it might be there. So our friends at Gallup constructed a regression analysis for us, so trying to understand what are the factors that predict high trust or low trust. And I want to show you a little bit of what that found. This is a communications access index. So this just asks people, do you have access to the phone, or do you have access to the internet, or do you have access to both? And what we found is that the more likely you are to have access to one of these communications technologies, all other things being equal, the higher your trust in scientists was. One of the stronger ones we found on this was science education. So the higher your levels of science education, the more likely you are to trust scientists. And again, that's perhaps an unsurprising, but I think important and reassuring finding. And what you see on the left there is that trust in scientists index. So the whole range goes from a minimum of 1 to a maximum of 4. So you can see the type of difference that having access to communications has, and it was similar for science education. But I think one of the most fascinating results in the entire survey for me was this one. This is the Gini index. So if you haven't heard of the Gini index, it's a measure of economic inequality within a country. So if you have a low Gini score, so that's towards the left of that, you're a country with very little economic inequality. So there's not much difference between the richest and the poorest people in your country. So think of places like Denmark, Sweden, and Norway, the Scandinavian countries that are typical of countries on the left there. Countries on the right, think of countries like South Africa, Chile, or the United States. Very high levels of inequality between the richest and the poorest in those countries. And what we find is that, again, all other things being equal, if you live in a more economically unequal country, you're less likely to trust scientists. And this is a finding we found again and again in the survey, that while the traditional story about science is that it's independent from society, it's free of the constraints of most of what goes on, it's universal, it has no borders, no boundaries, no nationality, what we find is that the way people think and feel about science is really heavily influenced by their personal and social context in a way that science doesn't necessarily touch. And that'll become more apparent as we go through. I should say that while the findings I've showed there are about trust in scientists, we also asked about trust in healthcare, trust in hospitals, trust in doctors, trust in governments, and there's a section on there in the report, and we have got copies outside if you want to delve into that, and obviously it's online as well if you want to take a look. A related question is who benefits from science? And again, there's an interesting narrative we always have about science, that it's one of those universal public goods, that the work that scientists do benefits everyone, everywhere, regardless of who they are or where they're from. We wanted to see, regardless of whether that's true or not, do people think it's true? Do people feel it's true? So we asked two questions. One was, do you think the work that scientists do benefits people like you? And again, globally, there was a really positive result here. 69% of people said yes when we asked that question. Over 2/3 of people think that the work that scientists do benefits them. And only 20%, 1 in 5, say no. But again, the regional variation is really interesting here. So Northern America, 83%, that's one of the highest, slightly behind Australia and New Zealand, with 84% responding yes, that was the highest. But again, we've got some regions of the world where significant numbers of people are saying no, the work that scientists do does not benefit people like me. South America was the strongest one there. 39%, nearly 1 in 4 people, nearly 40% of people saying that the work that scientists do doesn't benefit people like me. We asked a similar but slightly distinct question. Do you think that the work scientists do benefits most, some, or very few people in your country? So this isn't about you, this is about other people in your country. And you can see that global breakdown at the very top there. So 41% people say most people in my country, about a third say some, and 15% say very few people in my country benefit from the work that scientists do. And again, an interesting regional variation where you have Northern America, Australia, New Zealand, Southern Europe, Northern Europe. These are the countries where they feel most included in the benefits of science versus places like South America again. Over a third of people, 37% of people saying that the work scientists do benefits very few people in that region. And when you put these two questions together, this is the picture you get. So if you answered positively to both of those questions, the work that scientists do benefits people like me, and it benefits most people in my country, we called you a science enthusiast. And globally, that's the biggest single group. There are more people like that than anyone else in the world. Over a third of people are enthusiastic about the benefits that science can bring. That's the good story. The bad story is the flip side of that chart on the left. The skeptics were people who said no to both of those questions, and the excluded were people who said that science benefits other people in my country, but not people like me. And if you put those two together, it's 19%, so nearly one in five people. 1 in 5 people in the world say to us in this survey they feel disenfranchised from science, they feel not included in science, they don't feel the work scientists do benefits them or the people in their country. And I think for all of us who work in research and work in science, that should be a wake-up call, and it should cause us to, I think, pause and consider who benefits from the work we do and why do they feel that way. And why is this important? This is another finding. If you're one of those people that think that the work that scientists do benefits most people in your country, you're 6 times as likely to have high trust in science than if you think it benefits very few. So again, if trust in science is something we want to work towards, that question of who benefits, where are they, why do they think they benefit, and perhaps what's stopping them benefiting is really crucial. We wanted to have a special focus on gender. It feels like it's an issue that within the scientific community we're finally grappling with and taking more seriously, but we wanted to know how it works in the rest of the world. On this survey, we didn't ask we didn't test people's science knowledge. We didn't give them a science quiz, so we didn't have a way of actually testing their scientific knowledge directly. But what we did do was ask them to self-report their science knowledge. We wanted to ask them, how much do you think you know about science? And what we found was really interesting. The headline finding was that around the world, men are 11% more likely to claim they know a lot or some about science than women were. Here's the regional breakdown. So globally, the 11% figure is there at the very top. The region that had the biggest gap, the region where men were most likely to have a gap there, was actually Northern Europe. So where I'm from, men in Northern Europe are 17% more likely to report high science knowledge than women are, closely followed by South Asia and East Asia at 16 and 15%. The regions that had the lowest gap were Southeast Asia and the Middle East, 3%, so almost no gap whatsoever in self-reported science knowledge. And of course, there's a few potential reasons for this. It could be that perhaps women are underconfident in reporting science knowledge. It could be men are overconfident in reporting science knowledge. It could be that men genuinely do know more about science, and one potential way of testing that is to look at levels of education. If men have more science education than women do, that's a problem, but it might be an explanation for why we find that figure. So we tried to test that. And we found that for every type of educational level, men were still more likely to report science knowledge than women were. So this is broken down by primary, secondary, and tertiary education. That gap persists however much education people have. So I'll leave you to perhaps have a guess about what the driver for the figure is, if it's not actual levels of scientific knowledge. Finally, one of the standout bits of the report was attitudes to vaccines. Vaccines are one of those bits of science and bits of technology that almost everyone in the world is touched by at some point in their lives. It's one of those rare totally universal touch points with science that we wanted to understand people's perceptions of. And obviously it's also an issue that's had tremendous attention devoted to it recently, particularly in terms of vaccine skepticism. It's also a priority area for Wellcome. It's one of the areas we invest in quite heavily in as a way to grapple with both emerging and current infectious diseases. So we wanted to understand how it's being perceived. We asked a few questions. We asked, do people think vaccines are safe? Do they think they're effective? Do they think they're important for children to have? And if they're a parent, do they try and make sure that their children are vaccinated? And here's what we found. Globally, 79% of people said they thought vaccines were safe. Slightly more, 84% said they think that vaccines are effective. Slightly more again said that they would have their children vaccinated. And while those are encouraging figures, it's important to recognise that for a disease like measles, because of the infection dynamics, you actually need 95% coverage within a community or a population to ensure that you don't get potentially lethal outbreaks of disease. So the global picture is encouraging with room for improvement, but again, it's where the regional breakdown comes in that I think things get really fascinating. The overall picture, the overall trend you see from this is that if you live in a high-income country, you're less likely to think vaccines are safe than if you live in a low-income country. So the yellow bar is the people that strongly agree with those statements. Dark blue is somewhat agree, and then it goes on from there. And we find that the regions that have the highest number of people that strongly agree are Eastern Africa, 81%, South Asia, 85%, Western Africa, 75%. The areas where the fewest people strongly agree jump out immediately. You've got Eastern Europe. Only 37% of people in Eastern Europe strongly agree that vaccines are safe. Western Europe is 36%. If you're interested to know, for the US figures, 48% of people in the USA strongly agree that vaccines are safe, and an additional 24% somewhat agree. If you wanted to know which of the countries that stand out most here are those three questions, the three primary questions broken down by the top 5 disagrees for each of those. I think one of the most standout figures in the entire survey for me is that very first one, France at the top. 1/3 of people in France disagree with the statement that vaccines are safe. 1 in 3. In Gabon, it's 26%, Togo 25%, Russia 24%, and Switzerland still 22% disagreeing with those statements, either strongly or somewhat. Again, we've got a number of countries here where surprisingly high for us proportions of people are disagreeing that vaccines are safe and effective and important for children to have. On the flip side, these are the countries where the opposite was true, where the highest number of people said that they thought vaccines were safe, effective, and important for children to have. Bangladesh, 97%, Egypt, 97% agree that vaccines are safe. Rwanda, 99% agree that vaccines are effective, and a number of countries where almost everyone agrees that vaccines are important for children to have. While we're on this, there were 2 interesting things that came out. Rwanda is one of the countries that jumps out on this finding. 99% agree they're effective. It was the top scorer in another one of the questions we asked. We asked questions about, do people have confidence in their healthcare system? And Rwanda scored 97%. 97% of Rwandans have confidence in the healthcare system. There's only 7 countries worldwide that had higher than 7%, that had higher than 90%. And Rwanda was the highest of them all, and it's also an outlier on this score here. France was the highest score on disagrees with vaccines. It was also the country in the world that has the most negative sentiment about the likely impact of science and technology on jobs. It was the only country in the world where more than half of people in that country thought science would have a net negative effect on jobs in their local area. So we're seeing a lot of the connections between the different questions we ask here. Just to wrap up, and to bring us back to the beginning where we started, I wanted to finish on trust. The overriding trend on vaccines is this one about if you live in a higher income country, you've got less trust in vaccines than if you live in a lower income country. But there are some trends that run contrary to that. We found that if you have more trust in your government, you're more likely to trust vaccines. If you have more trust in your healthcare system, you're more likely to trust vaccines. And if you have more trust in scientists, you're also more likely to trust vaccines. So these are countries broken down by their economic level. So we've got low income on the left and high income countries on the right. And the charts show the perceived levels of vaccine safety within those countries. And what we find is that the more you trust scientists, if you have a high level of trust in scientists, that's the yellow bar, you're more likely to agree that vaccines are safe. And that relationship is strongest in high income countries like the one we're in now. So trust doesn't exist in a vacuum, and science doesn't exist in a vacuum. What we found through this report is that those linkages, those interlinks between how people feel about science and vaccines and governments and their personal economic situation, and that's one of the core findings. I've only scratched the surface. We asked about a whole bunch of stuff, which I've not had time to mention here. We asked about people's religiosity and whether they think their religion disagrees with science, and if so, who do they believe? We asked people about their confidence in the impact of science technology on jobs. We asked about whether they trusted traditional healers or doctors more. We asked about whether they lived in a city or the countryside and how that affected their response, and broke it down by age. We hope you'll tear into the data. We've released all of it publicly, so you can pick up copies outside, you can go on the website, you can go into the data sets and construct analyses and tell us what you find. But what we hope is that this will be a wake-up call for the whole of the research community to look again at the relationship between science and society, and recognize that if we want, like Wellcome, to improve health for all, and we see science as a route for doing that, we need to engage with society, we need to look at how these links work in practice. Thank you. And now I'm going to invite Olga and the rest of our panel up for the panel discussion.
Thanks everyone so much for coming, and thank you so much for that awesome presentation. So you just heard from Imran Khan from the Wellcome Trust, and I'm also joined by Mark Dybul from Georgetown University and Mary Woolley from Research America. And I was looking through these slides last night on my computer in my little hotel room, and I was going, wow, like audibly every few minutes, because some of these are really, really astounding, and they have such huge repercussions for measles, which is surging in the US, and so many other issues in public health. So I want to just dive into some of your findings. Can you kind of go into the income component a little bit more? Because it looks like, so the Gini coefficient, which is how unequal a country is, that it seems like it causes less trust in science. But then it looks like some really high-income countries like France don't have a lot of trust in vaccines. So what's going on there?
It's really fascinating, and what we see is that the different trends often run in opposite directions. So again, the vaccines one is a really interesting example of that, where the global overall trend is that higher income countries have less trust in vaccine safety, and we can talk about what the reasons why that might be. You know, my personal theory, it's the complacency effect, that because we live in countries that have successfully wiped out these diseases, we just don't see the ill effects as much, and therefore perhaps forget how important vaccines are. But within that overall trend, we also see some countervailing ones, that within that group of high-income countries, the countries that have higher trust in scientists also have higher trust in vaccines. So an interesting example of that is Japan. So we saw in the results that of the big 5 countries, Japan had the lowest level of trust in scientists. Only 11% of Japanese people had strong trust in scientists. And Japan also stood out as one of those countries that has the lowest confidence in vaccines. So with all of the stats in the survey and all of the trends, the caveat I'd always give is all other things being equal. So all of the things being equal, here is the effect you see based on these different things. Economics is really fascinating. So we found a couple of issues where your economic status within a country really colors your perspectives. So we found that if you're struggling to get by versus living comfortably, you have lower trust in scientists. We also found the same with healthcare. So people who are struggling to get by within their countries have lower confidence in the healthcare systems. And interestingly, that was preserved across all types of countries. So basically, poorer people in rich countries have, roughly speaking, the same level of confidence in their healthcare system as poorer people in poor countries. And the converse is true for richer people, which might not be the thing you'd initially suspect.
That's so interesting. And you mentioned complacency, and it's also interesting that correct me if I'm wrong, but the countries that have a lot of trust in vaccines still are countries in Africa where maybe they've seen some of the diseases that are preventable by vaccination, within their lifetime. But in the US, it's been a while since we've seen, measles kind of being widespread. So
absolutely. And I guess, again, for completion, it's important to recognize that perspectives on vaccines and things like vaccine skepticism, vaccine hesitancy. They're not the only issue to bear in mind when it comes to vaccine take-up. We've got everything from kind of the efficacy of healthcare systems to conflict zones, all this kind of stuff. I should say in the audience we've got Heidi Larson, who runs the Vaccine Confidence Project, who looks at this kind of stuff as well. And if you're interested in this kind of stuff, I'd really recommend looking at the Vaccine Confidence Project. We use some of their questions in our survey, and it gets to the heart of what you're asking about.
Right. Well, and Mary, that ties into some of your research where your organization found that trust in vaccines is actually going down. Is that just in the US, or is that?
Yes, so I'm from Research America, and we're a nonprofit alliance of patient groups, industry, academic institution, and scientific societies. And one of the things we do is commission public opinion surveys. So we've seen some alarming trends over the last 10 years with 10% or more decline on the responses to questions like, would you say that vaccines are very important to the health of society? And we've seen that gone down from 80% to 70%. Over a 10-year period. And this is U.S. only, just to stress. We've also seen an alarming decline in the percentage decrease, a 16 percentage point decrease in those they feel that vaccines have personally benefited them, from 75% to 59%. And I remember when we had the 75% finding, we thought, well, why isn't this 100%? But now it's just cratering. And this is, by the way, this is from 2008 to 2018, so it's before the surge in measles that's gotten so much attention in this country. It still is there still is a relatively high level, although it's declined also in the percent that say it's important for parents to vaccinate their children. And that's at 71% right now, but 10 years ago it was 82%.
Is there any, this is a question for anyone, but is there any insight into what's driving that? Is it just that discredited Wakefield paper from a few years ago, or is it something else? Is it something in the media? I don't know. What's happening?
I'll just give a few thoughts, because we've clearly been very concerned about this and talked to many experts and others who are working on this. So it's a combination of a lot of things. I think the Wakefield effect, definitely part of that. Another one is declining, in the US now, is declining trust and confidence in our healthcare system. And also an overall decline in respect for what we sometimes think of as elite institutions. This is outweighed, I might say, however, in the positive side. There has been no diminution in the trust and confidence that people say they have in scientists, the people, not the institutions, the people. And that's part of the reason why we feel so strongly that the best messengers to try to quell some doubts and change these statistics, if you will, and keep us all healthy, are really, it lies in the hands and the abilities of the science community itself to overcome some cultural resistance that's long been true in the science community, to do more to engage the public. And by the science community, I also want to include the healthcare community, physicians and nurses, because we also know from surveys we've commissioned that only 38% of the public believe that they're receiving enough information from doctors specifically about vaccinations. And that just seems like almost impossible to believe, but it's apparently the case. And so we've got to get a lot more people in and around the healthcare system engaged, including engaging with people who we sometimes describe as skeptics. It's so ironic to me that we can be critical as scientists of people who are skeptics, because scientists were trained to be skeptical, And it's okay to ask questions. Actually, that's a way we can really connect effectively with people who don't have science training, is to say, yeah, let's talk about it. Let's ask those questions, get them out there and find answers.
What is sort of the right tone to take? Because I think I was saying this to you earlier, but it seems often like people who are worried about vaccines, who are resistant, the more you kind of insist that your way is the right way and science has said, that this is the right schedule, sometimes that causes even more reactance and even more pushback. So what's the kind of balance there between kind of being supportive and encouraging, but also, conveying the truth?
So maybe I can comment on this actually. Most of my work has been in Africa and low-income settings, and I'm not at all surprised by the Rwandan data, and I'm also not surprised by data that show Gini coefficients lead to lack of confidence. I would say that all of this conversation relates to something that I see a lot in health, and I've been working in the same villages literally for 20 years, is we've lost the ability to engage communities. We are becoming such a top-heavy, institutionally driven approach to health in particular, but I think more generally, that there's no real engagement of people in the communities. And we've almost created a professional group of communities and civil society that actually are no longer connected to the communities either. Unless you get into a community and really talk with people, you're not going to succeed. And it's people who don't have access to things that also start questioning. I would also say that the communities will solve. I firmly believe that there isn't a single delivery problem that a community somewhere hasn't solved. We just need to get down there and talk with them. And for example, I was recently in Eswatini. I'm going back to former Swaziland. They renamed themselves. We all thought male circumcision was going to work there. They were going to drive male circumcision. This was going to reduce the HIV infection dramatically. And the strategy was to get the king, who's very powerful there, to say that it should be done, and everyone in the villages would do it because the king said it. Total failure. So recently I was in one of the villages, and I asked them, they said, well, the king actually didn't say you should, it was in Swati, so the white people who paid for the programs didn't understand what he was saying. He didn't say you should get circumcised. He said, they have told me to tell you you should get circumcised. Wow. And then the village worker says, I was never going to circumcise anyone because I thought it would increase sexual activity. But we think we can just tell people that, if a study says something will work, we can just tell everyone and they'll do it. If you don't get into the communities, we're going to fail. And David Brooks, who's speaking later, is very eloquent on this. We need to move from globalization to localization, but connect them, because you can actually connect global knowledge to local engagement. But we've totally lost the local engagement piece. And if we don't get that back, the risk even in low-income settings, even in Rwanda is high. Rwanda has community healthcare workers in every village talking to people all the time. Doing that. The data don't surprise me at all. Wherever you have those strong community-based activities, you implement, and you implement well. Wherever you don't, you fail. And that's true in the United States and Europe as much as it is true in Eswatini.
Can I build on that by saying that I think it's a good question, kind of how do we give the message the right way and who's the right person to give the message? But as important as the message is, I think what the data shows is that it's the relationship and the trust that's perhaps even more important, that people might have the same level of information and knowledge about, let's say, vaccines, but because of how much they trust their governments, their scientists, their healthcare institutions, how they perceive and take on that knowledge is different. So we find that in different countries, we find that, I think, for instance, in the US and in Germany, it tends to be if you've got a college level of education, you're more likely to believe that vaccines are safe. But in other countries, like, for instance, Israel and Iran and Belgium, the opposite's true. More educated people have lower trust in vaccines. So clearly it's not just about knowledge, it's not just about the message, it's about how that kind of sense of trust and confidence works.
Wow. And I just want to follow up on that, Mark. Is it community health workers, are they probably the best form of that you've seen, or are there other getting done at that local level?
We keep doing that. Health and health behavior, some of the worst people for that are health professionals, because we tend to tell. Nurses are a lot better than doctors. Community healthcare workers are better than nurses. But I'm not sure why Evan Hansen keeps coming up on our screen.
I don't know.
Anyway,
Message.
Subliminal, we shall see it. I don't know. But it really, and this is this is why the community is so important, because what will drive behavior in each community is remarkably different. So if you go from one municipality in Eswatini to the next municipality, you can get there in 45 minutes. What drives decision-making is entirely different. And if you don't actually understand who people listen to, who are the influencers in that community, you will fail. And we all think there's a one approach, and we just need to find the right program and repeat it everywhere. It's never going to work, and we know this. We've kind of hit a wall on where we are with progress in health and getting new technologies to people in communities. The delay is enormous, and some of it's regulatory, but a lot of it is just resistance because we don't engage where we need to engage. And so who you need to engage in a community will be very different in one country, let alone across countries. Mm-hmm. The issue is getting there and focusing on that. We've totally lost that. We have totally lost our ability, spending resources on it, engaging in it. We've totally lost it. And unless we start focusing on that, we will fail over and over and over again. And this is not unique to health. This is true of pretty much everything.
And you mentioned, so in Belgium, you said the more educated you are, the more likely you are to not trust vaccines. So that is super interesting to me, because how much of that is like reminding people that vaccines are great, and how much of that is reminding people that like jade eggs are not great? Like how much of it is like should we be focusing on debunking pseudoscience as opposed to, propping up science?
I think it's difficult to give a kind of global message on that. Again, to build on the theme we've just been talking about, I think we need to worry more about the relationships and less about the information. So my personal example of this is climate change. Mm-hmm. So if I think about the reason why I think climate change exists, it's not because I've looked at the atmospheric data myself and can analyze it. It's not that I've dug out the ice cores in the Arctic and look at how atmospheric CO2 has changed over time. It's that I trust science. I trust scientists. I trust the people I believe. I trust this process. And that's what really shapes my kind of sense towards an issue like climate change or vaccines or GM, whatever it might be. So yes, for some communities, we need to make sure that we're able to answer questions, we're able to get the right information out there, we're able to counter disinformation. But if we forget that how people perceive that information will be hugely colored by things like their economic status, their religion, their sense of security, their sense of confidence in their government and the military and the rest of their context, we're going to miss out. When people wake up in the morning, the first thing they think about, apart from me, isn't science, right? They think about, feeding their kids or going to work or what's going on with the neighbors next door. And if we don't remember that as science institutions, that people are messy and have other things going on, we're going to run into problems.
And something Mary said is very important in that, is the trust in institutions is going down, but the trust in individual people is not, and you need to know who the people are.
And to that point, Mark and everybody, it's just so surprising to so many people, myself included still after all these years, that the ability of Americans to name a living scientist or a place where science is conducted is astonishingly low. So the question is, can you give me the name of a living scientist? Yes or no. And the percent
Douglas.
The percent of people who can name a living scientist is 20%, 1 in 5. And some of the people they name are dead, which is just, that's the way it goes. We don't have to keep score of every single person. But that percentage hasn't changed for almost 30 years, despite so many efforts by so many people to try to do a better job of connecting by putting a human face on science. Even more shocking, really, is this pretty simple question. Can you give me the name of some place, any place, where medical or health research is conducted? Any place. Yeah. Only 33%, or 1 in 3, of Americans can give any name of any place. And again, that hasn't changed for a quarter of a century plus. And people don't know, and this is only, of course, US relevant, but 75% of the people in this country don't realize that research is taking place in all 50 states. That has political ramifications, but it also is just an indication of how distant people feel from scientists of all kinds, and particularly medical and health scientists, which is the group that we focus on, and trying to help those scientists stop talking in the first person invisible tense and start connecting.
Right.
People, which is what I think we all are saying. Make those connections.
Well, I want to open it up to questions from the audience. I believe we have mic runners, so raise your hand. I think I saw a gentleman in the blue shirt right there first.
Thank you so much. My name's Aaron Mertz. I direct the Aspen Institute Science and Society program.
Oh, yes.
I am really interested in the nuanced communication and also how to make sure that the wrong people are not getting strong voices. And I'd like to hear the moderator's view about this on the journalistic front. I was astounded in the past week to see headlines like, what do these 11 actors think about vaccines? Why is that a phenomenon? How do you make sure that the right voices, as Mary was saying, scientists and biomedical workers are having the platform, or what Mark was saying, the right community leaders in the villages have the right voice?
You're saying, how do we amplify better voices, sort of?
And quiet the ones that might not be.
That's a little hard.
Yeah, do you guys have any thoughts on that?
I wish I had a straightforward answer to that. I think that, if it was simple as getting certain people to shut up, then we probably wouldn't be here debating this. I would say that, so another question that keeps coming up is the answer to this mandatory vaccination? And is the answer to this perhaps, perhaps even criminal legislation preventing people talking negatively about vaccines? And I think that feels very tempting, both sides of that. But again, one of the examples that comes to mind for me is Japan, where a lot of the recent drop-off, as I understand it, in confidence about vaccines is due to the HPV vaccine, where there was a scare story there. So this is interesting. Over here we've got Wakefield and MMR, and in the UK it's the same, but in France it's influenza, in Japan it's HPV. You get different scare stories in different places. But in Japan, the government actually changed their position on HPV. They bowed to public pressure, they didn't follow the science, and they changed the guidelines on the HPV vaccine. And that shows me that even when you have regulations that are based in science, ultimately public opinion, public pressure, public discourse can still have an impact. So even if there is a kind of an easy win to say, all right, let's just get that actor to shut up, if we don't carry on doing the work of engaging with people and making sure that they're trusting scientists, healthcare institutions, and other people that are sending positive messages, then we risk getting back to square one. So I don't have an obvious answer about how to get...
I heard the question a little bit differently, and in fact, those regulations can drive people even worse off and having a worse view. I heard it more, where's the responsibility of how we're covering things? So if because we need sensationalism, and if we have 11 actors, whose kids have a very low risk of getting a disease, and that's who we highlight, that's a problem. But where's the responsibility for, which I would say we're losing too. We have less and less sense of responsibility of what do we say and how do we say it. Because we will have failures, there's no question. And we'll have scientific failures. Science by its nature will have failure. And there will be side effects to products. Inevitably, we used to joke in pharmacology, there are two effects to every drug, those that are known and those that are unknown. I mean, we don't know until you're in millions of people, literally. So these are going to happen, and how do we responsibly deal with that? And I think it's a fair question of where the responsibility among journalism and journalists are, because that's where a lot of people get their public information. Now, there are a lot of other ways to do it too, and then what do you do about Facebook and social media and other mechanisms as well? But I think it's a very valid question of how do we understand and reach the right people?
Right.
And where's the responsibility from journalism? I think I heard the question. That's what you were asking.
I've got...
Yeah, well, yeah. I mean, we could be here all day if get me started on journalism. But I mean, it's hard because sometimes you don't know whether you're highlighting something or reporting on it, and sometimes really hard to draw that distinction, and it's something we struggle with every day. And some websites and news outlets are better at it than others. So I don't know which one had the like 11-actor slideshow or whatever, but I mean, we try not to do that.
But there are lots of countries in the world with a free press that still have high confidence in vaccines.
And I think for looking further out, it would be very useful when we're educating journalists, and there's no lack of students applying to journalism schools these days.
Yeah.
There's a lot of interest. Journalism is changing, but there's a lot of interest in being part of it. So in journalism schools, I think there should be some exposure to, some opportunity to learn how to report on science. And there's always going to be issues one way or another that come up that involve science, and very few journalism schools today have that kind of exposure. Similarly, in medical schools and in science post-baccalaureate science programs, there's almost no exposure at all to how journalism will always be part of the larger public frame and the public context of the work of a scientist. And it's time for that, too.
Yeah. Next question. Oh, sorry. Go ahead. Yeah. Sorry.
America's Health. I wonder if you think that a part of the issue may also be when people don't have explanations for why bad things are happening and that science can't answer, and they're looking for explanations when they feel a loss of control. For example, I was formerly a state health commissioner, and some of the most tense meetings we had were with parents of children with autism, where they wanted explanations from us about what was happening with their children. Why couldn't we, if we had the scientific answers, explain things like that, or explain the prevalence of other illnesses for which we don't fully understand? Do you think that that's part of the issue, that people perhaps have unrealistic expectations that science should be answering questions, and if they can't, that means people may perhaps need to come up with alternative perspectives on what's happening?
Well, I do. I'll jump into that. I think that the science community and also the medical community has, over time, kind of set itself up as having all the answers to ill effect. You know, doesn't come comfortably to, especially medical professionals, to say I don't know, or to scientists for that matter. You know, it's just kind of counter to all the to their training and to the way they are recognized by their peers. So a little more humility would go a long way. Again, over the long haul, that doesn't solve the immediate problem of the parent or a patient, an adult patient who wants answers, but some empathy and listening rather than in some way making people feel terrible that they don't understand something that you do understand, which you may or may not understand. We do have a ways to go on that. It's a real issue.
And one of the problems which we've seen over and over again, as you're pointing out, is the narrative you can spin if you don't get the answers pretty bad. Like, you know, HIV was a CIA plot, for example, which was still is actually a prevalent theory in some places. And the more we can explain in a humble way why we don't know and what we're trying to do, but also drawing in the right people who can influence in a way that it's very difficult that for the person that they're not trusting at the moment to be the person that has to answer that question.
Hi, my question is for Imran. My name is Setu Vora, and I represent Mashantucket Pequot Tribal Nation. In your report, were you able to segment indigenous populations by names?
I'm not sure. I don't think we would have done. So for most countries, we had a sample of 1,000 people. Some countries like India and China, we had bigger samples. That sample of 1,000 is usually big enough to segment by gender, age, educational level. It's probably not big enough to effectively segregate by smaller populations. So I don't think we do have that data, sorry. But I should say that all of the data is publicly available on our website. So if you do want to dig into any of the segments that we haven't either reported on ourselves or I've not presented, we would love more people to look at that, perhaps compare it to other data sets, let us know what they find, and we'd love to help you amplify those results.
Yeah, go ahead.
Hi, my name is Victoria Mazes, and I direct the Andrew Weil Center for Integrative Medicine. And I have two questions. One is, one of the challenges is this enormous polarity. I will say, as an integrative medicine physician, I'm absolutely pro-vaccine. But I also have enormous empathy for families, as you mentioned, where there's a child with autism, regressive autism. Something has triggered that, and vaccine is one possibility. And I think for us to have this absolute stance on vaccines can never, ever be a contributor is not helpful. We need some kind of middle ground for children who have horrific illnesses at rates in which didn't exist when I first became a physician. And the second thing is that I believe we really need to be a little bit more honest that vaccines are not all the same. There's no question that Haemophilus influenza B, which prevents meningitis. When I was a resident, I regularly admitted kids with meningitis who ended up with brain damage. That doesn't happen anymore because of the Hib vaccine. Fabulous. Measles vaccine, incredibly important. But chickenpox vaccine, HPV vaccine, it's a little harder to make the public health case that those are absolutely as important. And yet we have this very black and white stance on it.
I think I'd say that the overwhelming scientific consensus is that vaccines are safe, and they're one of our most successful historic tools in eliminating some diseases. And the fact that we have concern about the idea of vaccines as a technology, that kind of safety concern spreading, risks undermining a lot of the good work that's been done. Where I agree with you is that if we don't have more empathy, if we don't listen to people, if people who have those concerns about whether it's a condition like autism or vaccines as a technology, and if we don't make them feel that actually scientists care, that health professionals care about those concerns, then we're going to keep having the same debate over and over. So I agree, it's a number of comments that have been made, that feeling of the idea that scientists care about what I'm saying, they care about what's happening to my children, and that colours their responses and colours their work. We have to get to that place, and it's not going to be done just by repeating the message that vaccines are safe.
Yeah, go ahead.
I'm Denise Diani, and I am here. I work with public television, and I'm here because I do believe journalism and media has a role in this. And not to be pessimistic about it, but I think probably the only trust statistics that are probably lower than what you're talking about now are the trust statistics about journalism and media.
No, Congress is lower.
Well, low Congress as well.
Thank you. Thank you,
And I will
Congress.
say public media still has a relatively high trust level, but a lot of journalism, as we know, does not. So I think while I personally support that we have a role and that's an important educational mechanism, I think we have a bigger problem because I think the conflict we're facing, or the circumstances we're facing, have to do with a lack of trust in fact-based information of all kinds, and not to be political, kind of a post-truth era. So I appreciate what you're saying about community, but I don't know what other tools we can deploy given what's going on right now. And again, I think we'll keep on fighting as journalists, and you'll keep on fighting as health practitioners. But not to be pessimistic, I've been doing this for a long time, and it feels tougher than ever.
So I guess the question is, how do we advance the message when people don't trust the messenger? Yeah.
So I don't think it's necessarily fair to say they don't trust the messenger, in that, yes, people might have low trust in politics or low trust in the media, but if you ask them, do you trust The Guardian, or do you trust Fox News, or do you trust Donald Trump, or do you trust Jeremy Corbyn, you might have very high responses. So although the media or politics and establishment might have lower trust, politicians and media outlets still have the capacity to generate tremendous levels of confidence and trust and a sense of community amongst their audience. So I think, yes, that there is a kind of a concern there, and perhaps that concern has been there ever since media and politics were first invented however many thousand years ago. But I don't think we should kind of give up hope and say these can't be important tools for advancing where we are in terms of the public discourse on science and health.
We have time for one more question.
George Kikano, Family Medicine Academics. Can you comment on the use of politics, government, including ours, use of community health workers, vaccines for political gain and intelligence in the case of bin Laden?
didn't quite.
Sorry, didn't quite catch the
Could
question.
you repeat that? Sorry.
Use of vaccines and politics and community health workers to gather intelligence, leading to mistrust for vaccines among governments and low SES classes in third world countries.
You're saying how rumors about vaccines spread in third world countries?
Great job.
Yes.
Oh, right. Yeah, that's a good question. Yeah. Yeah, how has that impacted things?
Yeah, so this isn't something we looked at directly in the report, but we have heard of examples of, for instance, in Pakistan, where vaccine programs were used as cover to try and obtain evidence on bin Laden and Taliban. And again, that's an example of how the trust in vaccines is not simply related to how safe vaccines are. There's a whole host of other effects going on there. And if we don't, as a community of science and health organizations, understand those effects and understand how they make people feel, and if we only stick to this message that the science is all that's important, we're going to fail. So I think that's a really important example to raise.
I think it gets back to understanding people, and I think this is a common theme here. There's lack of confidence in institutions, but there is strong confidence in people,
Yes.
and at different levels. There's confidence in certain leaders. There's confidence in different sectors of leaders, and there's a lot of confidence at the community level. We had the same problem in Africa with HIV. The question, to your point, was why is there so much more HIV in Africa than there is in other parts of the world? And we couldn't answer that question. And so people came up with theories, and one was, through vaccinations, the CIA is spreading HIV to kill off Africa. That was a very prevalent thing. But if you didn't get into the community and work with the community and understand who could counteract those theories, you couldn't win. And that meant involving churches and the imams, and it meant looking at the community leaders, and it meant understanding in Ethiopia was working with the coffee ceremony. We used to do all that stuff. We used to understand that if you don't understand the community, you can't succeed. We've kind of lost all that in the last 15 years. We've reverted back to a more paternalistic, we know the answers, the communities don't, we're just going to tell them what to do, and it's going to happen. And all these great new technologies that are coming are not going to get anywhere because they're going to keep hitting these walls if we don't fundamentally change and shift back to the community, understand the community, empower the community, spend money there. And that's where I think, again, what David Brooks has been talking about, globalization is great, ideas, sharing of ideas, but if it's not localized, if it's not brought to the local level, the lack of belief in the institutions is going to stop a lot of stuff, not just vaccines and not just healthcare. It's fundamental around education, it's fundamental around climate change, it's fundamental around technology. France linking science, which you didn't specify health science to them.
Right.
They were thinking about losing jobs because of science. That was a huge. They weren't talking about health science. They were talking about automation, right? So we really have to understand, and if we don't make a shift pretty soon, and we keep relying on old mechanisms to solve the problems, we're going to be in we are in deep trouble. We're not going to get out of it.
And I think that's, I agree. We all do.
Did you have something?
I think that's kind of the next step of this really rich database that you have put together, you and your colleagues have put together. Imran and you and I were talking about that earlier, is, what's the actionable next steps? We could spend the rest of the time in Aspen talking about those, I'm sure with many people in this audience.
Yeah.
It's really important that that work get done.
And I'll just finish by saying two final things. One is we spent a lot of time talking about vaccines today. I just want to give one last call out to the Vaccine Confidence Project. We're really lucky to have Heidi Larson in the audience. Heidi, I don't know if you want to just wave to people. If she's genuinely the world expert on all of this stuff, so if you're interested and want to know more about how we can do this. do come and talk to Heidi or look up the work of the Vaccine Confidence Project. And secondly, just to remind you that we have the report online. You can delve into it. I've genuinely said probably less than 1% of what's in the report. The full data set's there. We'd love you to explore, look at the infographics, analyze the data yourself, compare it with other data sets, found stuff that we haven't found, and tell us what stories are there. And hopefully together as a global science and research community, we can ensure that this data gets translated into better health outcomes for everyone.
Thank you all so much for coming. If you guys want, I just want to, the website, correct me if I'm wrong, welcome.ac.uk/monitor, is that right? Okay. And then researchamerica.org for Mary's stuff, if you guys want to dig into that. Thank you so much for coming to the first session.